Welcome, everyone, to another episode of Inside Lyme Podcast with your host, Dr. Daniel Cameron. In tonight's episode, Dr. Cameron will be discussing a paper which makes no mention of a Lyme disease evaluation as part of a post-COVID assessment. The case was first described by Roth and colleagues in the journal Global Advances in Health and Medicine and was entitled Addressing the Long COVID Crisis, Integrative Health and Long COVID. Thank you, Dr. Cameron, for joining us and talking a little bit about this paper. The authors, it appears, covered two separate cases. Is that correct? Can you tell us a little bit about those?
Yes, these are cases you'll get to know pretty well because they have symptoms that are very similar to Lyme disease patients that I take care of. So the first one was a 44-year-old man who had been sick with long COVID for 7 months. And it was a kind of a mild infection at the time. And a lot of people in the literature, they don't always have to have severe disease. They just can go from mild to long COVID. So they happen to have pre-existing type 2 diabetes, but they also had headaches, fatigue, daytime sleepiness, and brain fog, the type of symptoms that people with Lyme typically talk about and complain about. And these symptoms all persisted despite neurologists, ophthalmologists, otolaryngologists, and I thought I'd mention them because they didn't include a Lyme doctor or somebody familiar with Lyme. And so if I had seen that person, I would have had to dig in and look a second time at whether there's something else going on. The other one was a 48-year-old woman who had a mild COVID again, and 9 months later was sick with long COVID. And you'll see the symptoms again are similar to what someone has with Lyme, like migraine headaches, shortness of breath without wheezing. Now that's important because some people with Lyme have babesia and they have air hunger. And there's chest pain and palpitations, which are something we see in Lyme because a lot of people with Lyme have autonomic dysfunction or POTS. Frequent panic attacks, and we know all the neuropsych issues that come from Lyme, and fatigue. She happened to have a little bit of asthma, hypertension, migraines, and right carotid artery dissection in the neck. So I just thought I'd bring these two just to sort of understand better when someone says they have long COVID, what kind of symptoms they're talking about.
Can you talk to us a little bit about the treatment regimens for these patients?
They decided that they would treat mostly the symptoms because, most of the treatments that are talked about now are for COVID are, acute issues, trying to prevent COVID, take the vaccine, or treat any of the pneumonia findings and those type of things. Or if there's vascular issues, how to take care of that. So after they've been sick for a while with long COVID, then they listed in this paper some of the things that are used. One is a combination of treating the symptoms and helping with self-care. They tried integrative medicine, discussed life goals, medical needs, and lifestyle. So you could tell, with these two patients that they're still sick. And even if there's approaches to take, unfortunately, these patients still had lingering symptoms, and they had problems that I can understand taking care of someone with Lyme with the same issues.
So what's kind of the takeaway from this when you were reading it that you wanted viewers and listeners to know or think about?
Well, I always find that Lyme disease patients are often sick for a long time before they get around to being treated for Lyme. They'll go to doctor after doctor and specialist after specialist, and Lyme never comes up, or if it does, they'll dismiss it saying chronic Lyme doesn't exist. There's no evidence chronic Lyme exists. So now you have someone's been sick for months, and two people, and they're quite sick. And I can understand the frustration they must have. But as a doctor who works with Lyme and Tick-Borne, is that I don't want a Lyme patients to not get diagnosed with Lyme, because there is a treatment for Lyme other than just treating the symptoms. I also find it hard with somebody who's had Lyme themselves, is that COVID is pretty stressful. And we know that COVID seems to affect some of the same neurotransmitters like cytokines. And so it's going to be difficult for a patient of mine who has had Lyme and now they have long COVID, could have both. But I just thought this paper reminded me to think about the needs of a Lyme disease patient when they get told long COVID, because they go to the doctor and every time they say something, they get another COVID test. And they already get a positive test. They know that from the vaccine. They know that from the Lyme itself. And so it's just kind of sort of widening my understanding of long COVID.
So it's if you've had COVID and these symptoms persist or new symptoms develop, to not necessarily assume that it's related to that, to always keep tick-borne illnesses in mind.
Right. I think that as part of an assessment, if you're still sick, you're still having problems, it's better to include a doctor who knows Lyme well to look over it to see if there's a treatable problem, see if there's evidence of a persistent infection, because so otherwise they'll just sit around and treat the symptoms and it might miss an opportunity to find an effective treatment. I also should say that given that this has been going on for months, is that a lot of people get Lyme, when they're outside, they're doing things. So anybody from the beginning of the COVID pandemic, many of them are active, many of them have gotten pets during the pandemic and could get a new infection. And that's going to be complicated if you get a new bite, new infection, or a new infection without a rash. And so it's important that for anyone to at least keep Lyme on the radar.
Well, thank you so much for bringing this to everyone's attention and discussing these cases. We appreciate it and look forward to the next podcast. For our viewers and listeners who'd like to learn more, read about this paper, they can do so at danielcameronmd.com. Thank you again, Dr. Cameron.